Hello everybody. We're starting the flu and chesty season, but also the achy joints and knowing what the weather is like tomorrow with your osteoarthritis. So I'm going to talk about turmeric. And turmeric has a wider application than osteoarthritis, but it is one of the biggest indicators for it. So I'll talk generally about turmeric. You might know it as this lovely deep yellow ochre powder with a very gentle spicy taste. It's one of the ingredients of curry, and I use it when I saute onions to make everything. Right? All of my omelettes are a bright sunny yellow. All my soups, stews, casseroles, everything has a good teaspoon of turmeric for every 2 medium-sized onions. And into that I also put some black pepper, because you get better absorption or bioavailability of the active ingredients in turmeric. And that's the turmeric that I really encourage everybody to use because of its chemical properties. So that's the turmeric. These capsules are simply the powder in a capsule. So the amount of turmeric is 3 to 6 teaspoons a day. You wouldn't need 6 teaspoons unless you're dealing with some kind of severe inflammation. But certainly an average of 1 to 2 teaspoons a day, which would be 2 to 4 capsules. For treating any inflammatory arthritis, you can go up to 6 teaspoons of turmeric per day. Now, if the reason why the sauteed onions works well is because the extracts from turmeric are better with a little bit of fat. You can also make turmeric tea, where you would put 2 teaspoons of turmeric to a large mug of water, but I would advise you to put a little bit of milk with that, anything that's got some fats. So almond milk would be fine, dairy milk would be fine, so either of those. You can also use it in ghee. This is known as the Asian aspirin, and this is what all of the doctors that I worked with in the UK in hospitals, this is what they would take for any kind of a flu or fever or digestive upset. So this is their first go-to for their medical cupboard. We have a product here which is Holly's Golden Turmeric Paste, and it's a blend of the turmeric with coconut oil. So coconut oil again is a fat, and it makes better bioavailability of the active ingredients in the turmeric. This is a concentrated form where they ensure that there's a standardized amount of curcumin, equivalent to 500 milligrams in a daily dose of extract. And the daily amount of extract is 500 milligrams to 1,000 milligrams. So usual dose of that is 1 a day. Under medical herbalist advice, it might be increased. So there are all the different ways that you can take the turmeric. So why might I be encouraging everybody to use turmeric? The biggest reason is because, as I say, with the arthritis, it's anti-inflammatory. It is antioxidant. It affects the neurotrophic factors in the brain. So it's a bit like a growth hormone for nervous system tissue. That's on lab results rather than clinical results. So with of those actions, you can imagine that it would be good for the prevention and management of early Alzheimer's, but prevention is what we're mainly talking about today. So by preventing the inflammatory tangles, which is what underlies the condition of dementia, but also the dementia if it's caused by circulatory problems, because it's also indicated for the kind of inflammation that underlies angina and lack of oxygen to the heart. So the antioxidant effects and the growth hormone effects, and you can add to that 3 different ways in which it is an anti-cancer, or it helps the body deal with the cancer cells that we create on a regular basis. With or without cancer, we create cancer cells. If they then go rogue, that's when you have a problem with a clinical diagnosis of cancer. But to prevent that, you keep dealing effectively with all of the ones that we make on a daily basis. Now the other, you might think that's plenty from one phytochemical compound or group of constituents, but there is also antimicrobial effects of the turmeric, which make it the reason why throughout Asian countries they use it for coughs, colds, flus, chest infections, all that kind of thing. So there you have it. We all like 2 for the price of 1, but I think I've just given you about 5 for the price of 1. So you have every reason for using turmeric in your diet, in your food, turning to it in your medicine cupboard, particularly for things like arthritis that you manage yourself anyway once you've had a reliable diagnosis. Cautions would be, there are very few. One would be for somebody with biliary disease, either an autoimmune biliary disease, any kind of obstructive biliary disease, or recurrent gallbladder, gallstone inflammation. And with medicine, using it in food amounts is no problem. But if you're on anticoagulants, particularly warfarin, then you need to be cautious. If you're a diabetic, no problem introducing food amounts of turmeric. If you're going up to the 2 or 3 teaspoons a day, then you need to be sure to monitor your blood sugar levels, because we've just added a 6th reason to take the turmeric, as if we needed more. It helps lower unnaturally high blood sugars. So it can be part of helping to manage with your diabetes, but that's no good if a combination of that and your medication dips your sugars too low, which can be a problem. So if you want to use the turmeric and you're a diabetic and you're on medication, food amounts, no problem. If we want to use it therapeutically, my advice is to see a medical herbalist. But whatever you do, whatever you change in your food or your drugs, you always, or if you're unwell, you always go back to extra checks of your blood sugar levels to make sure that you're staying within a stable and safe range. So I hope that's all useful to you. And I hope you enjoy the lovely flavour, the lovely happy food colour, and have a healthy winter.